Hello, everyone. My name is Kira Meister. I am the Senior Communications Manager at the Prevent Cancer Foundation, and I'm so honored today to be joined by three incredible physicians from Kaiser Permanente. Today with us, we have Dr. Kwame Akoto, Dr. Shanique Palmer, and Dr. Pim Suwanraj. So we're here today in honor of National Black Family Cancer Awareness Week and to discuss the importance of early cancer detection and how we can advocate for our health by proactively embracing healthy lifestyle choices. So before we get started, I'll just give our panelists a moment to introduce themselves. Dr. Akoto, if you'd like to start with that for us.
Hi, everyone. My name is Kwame Akoto. I am a family medicine physician practicing in Baltimore.
And hi, everyone. I am Shanique Palmer. I am an oncologist practicing with Kaiser in Baltimore.
And I'll round things out. I'm Pim Suwanraj, or Dr. Pim, and I am a clinical geneticist practicing across the KP Mid-Atlantic region.
Great. Thanks, everyone. I'm so happy you're with us today. And so Black Family Cancer Awareness Week actually began in 2021, and it had a purpose of increasing awareness among one of the most vulnerable segments of the US population. So I hope everyone tuning in today enjoys hearing from the perspectives of our three doctors with us today, and I hope you all learned something new. We also encourage you to drop any questions you have in the comments, and we'll do our best to get to as many as we can. But with that, let's jump right into some of our questions that we have. So starting with you, Dr. Akoto, in addition to Black people in the US being more likely to develop many types of cancer than white people in the US, the Black community also has the highest mortality rate for most cancers. My question for you is, what are some of the factors that contribute to this? And additionally, what are the main obstacles that Black people face regarding cancer prevention, detection, and treatment?
Thank you. So there are a few different factors. There are about 8 big ones, though, that I like to talk about that I think are a really big component of what you just mentioned. So the number one thing is healthcare access. So we do know that Blacks are more likely to be either uninsured or underinsured, which limits their availability in getting into the healthcare system. They also have less access to high quality healthcare facilities in their neighborhoods. So that's one big part that's going to affect their screening. The next one is socioeconomic factors. So lower income and education can impact our health literacy, which is a really important part of us engaging into the medical system. The third one is genetic factors. So there may be some predisposition to certain cancers and their susceptibility based on our genetics. Lifestyle and behavior is the fourth one. So differences in diet, smoking rates, and health-seeking behaviors, as well as cultural beliefs and mistrust of the healthcare system can lead to delays in seeking care. The fifth one is environmental exposures. So Blacks tend to live in neighborhoods that are more susceptible to environmental toxins and pollution, as well as working in jobs where exposed to more chemicals and other substances that might increase our cancer risk. The sixth one is screening and early detection. So we do know that lower rates of cancer screening lead to cancer being discovered at later stages of the cancer, which are much harder to treat and then leaves us susceptible to higher mortality. The seventh thing and the eighth thing sort of go together. So systemic bias, there are some implicit biases and racism sort of built into the healthcare system that can affect the quality of care. And then the chronic stress, the long-term stress from discrimination and economic hardship has really impacted overall health in general. So addressing these disparities really is going to involve improving healthcare access, enhancing education, addressing these socioeconomic barriers, and combating systemic racism in healthcare.
Thank you so much for sharing. I think when you list it all out like that, the barriers, you think of them as one or two, but there's so many that you three are all trying to help eliminate. So thank you for the work that you're doing to make that happen. And Dr. Palmer, I'll toss it over to you now. I know we mentioned there are quite a few types of cancer that affect the Black community differently, but could you tell us what are the leading types that do affect Black people differently?
Of course. So there's several cancers that affect the Black community in the United States, including prostate cancer, breast cancer, lung cancer, colorectal, cervical cancer, just to name a few. And to take a deeper dive, for prostate cancer, Black men have the highest incidence and mortality rates of prostate cancer compared to any other racial or ethnic group. They're often diagnosed at more advanced stages, which contributes to the higher mortality. And factors contributing to this are some of those that Dr. Cotto discussed: genetic predisposition, disparities in access to screening and treatment, differences in tumor biology, all contribute to these higher rates. With breast cancer, this is the most common cancer among Black women. And despite the fact that there are similar incidence rates to white women, Black women are more likely to be diagnosed at later stages and have higher mortality rates. And they're also more likely to be diagnosed at a younger age and with more aggressive forms of the disease. Both Black men and women have higher rates of lung and colorectal cancer incidence and mortality compared to other racial groups. And for cervical cancer, Black women also have higher rates compared to white women, as well as significantly higher mortality rates. I'd like to make mention of multiple myeloma, which is a blood cancer where Black individuals have twice the incidence compared to white individuals, and higher mortality rates as well, also influenced by genetic factors and healthcare access disparities. So really, we can see that there is really significant impact on the Black community. And so efforts to reduce cancer disparities in the Black community are absolutely necessary and really require a multifaceted approach.
Right. And I know at the foundation, the Prevent Cancer Foundation, we're really big on early detection and prevention. We often say early detection equals better outcomes, as many of the cancers you just mentioned offer screenings where you can prevent it or detect it early. So Dr. Cotto, specifically on the Black community, how can early detection help to reduce the impact of cancer?
So several different ways. Number one, and most important, is it improves their survival rates. If cancer is detected at an earlier stage, that makes it more treatable. You have more options for treatment, and survival rates are higher in general. Another thing is that if it's detected earlier, then you generally will need less aggressive treatment. So the early stage cancers tend to have less invasive and aggressive treatments, which leads to better outcomes and also a better quality of life for the patient that has the cancer. It's also more cost effective. So one thing that we don't talk about often is cancer is expensive, right? The treatments, you have to take time off work, you have to do all these different things, go to different doctor visits, all that's expensive. So the financial burden can be reduced if this can be detected earlier and lead to less aggressive treatment. Quality of life, again, is very important, and early intervention can help you maintain that quality of life that you want to have with your loved ones and for yourself. It does also increase your treatment options. So there are more treatment options that are available for early stage cancers versus later stage cancers. And then there's also a public health impact. The more we all do to prevent cancer, detect it earlier, then the less financial burden will be on the entire healthcare system. So those resources can then be allocated to other conditions as well.
Great. And with it being Black Family Cancer Awareness Week, it's very fitting that we talk about family history as well and how that can impact cancer risk. So Dr. Pim, I'd like to turn it over to you to discuss a little bit about family history and how that impacts one's cancer risk. I think people are often surprised to learn that how it does play a role. So I'm excited to hear what you have to say here.
Family history certainly impacts our cancer risk. One aspect of that is the shared environmental exposures that Dr. Cotto just mentioned. But more importantly, the shared genetic risk factors that Dr. Palmer was also referring to, that we inherit from both of our parents, our mother and our father. And there's one big misunderstanding that we see frequently. For example, a risk for breast cancer is only inherited from your mother's side. That's not correct. Men have breast tissue also, but more importantly, men and women have all of the same genes that are controlling our risk for cancer, and all of those factors can be passed on to our children, whether it's to our sons or daughters. And so it's really important to take into account the family history on both sides of the family in knowing a little more about your own cancer risk.
Right. I know I was personally very surprised when I learned that it's only about 5 to 10% of cancers that are hereditary. So while that's a small percentage, if you do have a family history, very important you get that checked out. But regardless of family history, it really does make a difference to
Correct.
get screened regardless of that.
Right, right. But when you look at that, 5 to 10% of cancer is directly related to heritable genetic risks. And then there's another part of the pie that is equally significant where there are familiar factors and traits, including those environmental factors or genetic factors that we might not be smart enough to know about yet. So then it even expands even further to looking at your family history, not just related to those clear cut genetic risk disorders.
Right. And so when it comes to talking to your doctor, at the foundation, we have a family health history chart that we encourage people to fill out to bring to their provider to kind of figure out what sorts of screenings they should get started earlier if they have a family history, or just to kind of know that whole picture. But when it comes to talking with your loved ones, the people who do have histories of certain cancers, Dr. Palmer, what are your tips for starting a conversation with loved ones about these topics?
Yeah, so starting a conversation with loved ones about the family's health history can be sensitive, but it's really crucial for understanding potential genetic risks and promoting health. And one of the most important things is getting yourself educated about the high risk of different cancers within the Black community, and also becoming educated about the importance of early detection. And then, armed with this information, we can approach our family members to engage in open and honest conversations to in turn increase their awareness and to share the importance of discussing the family's health history. Really explain how it can help everyone understand potential health risks and take appropriate steps. I would therefore encourage each of us to take the lead in getting informed, getting any necessary screening tests, and being open and honest with loved ones to try to in turn encourage openness and transparency. Encourage how knowing the family health history can help with early detection and prevention of diseases. Highlight that this information can really and truly inform medical decisions and lead to personalized healthcare plans for everyone. And if there's a recognized genetic predisposition, consider involving a genetic counselor, asking your family doctor to connect you with a genetic counselor or other healthcare professional to facilitate the conversation and provide additional insights. And it's important to note that this should be treated as an ongoing conversation rather than a one-time discussion. Regularly update the family health history as new information becomes available, and encourage family members to do the same. And so really, by approaching this topic thoughtfully and sensitively, you can gather important and valuable information about the family's health history, which can be crucial for managing your health and that of your loved ones.
That's a really good point about having it not be a one-time conversation. Because I think oftentimes you think of like, okay, I've checked it off the list, but really every year you're visiting your healthcare provider, hopefully if it's an annual visit, you're kind of having that conversation again, making sure nothing's changed. I know whenever I go to the doctor, I'm always like frantically calling my mom to make sure I know which side of the family that this certain disease took place on or whatever. It's hard to remember, but I think doing it often and frequently and making it a normal thing makes it a lot easier for us to kind of remember to continue. Yeah. So Dr. Pim, if you do learn you have a family history of cancer and you kind of learn that information, what should you do next? Like, what is the next step one should be taking?
So if you do have a family history of cancer, or you're having these discussions and you're hearing about someone diagnosed with cancer, having these multiple conversations can be helpful, like Dr. Palmer mentioned, because some things that are really important are the actual type of cancer and the age at diagnosis. And sometimes that's not an easy conversation to have initially, and you need to work up to that. But determining the type of cancer, the age at diagnosis are incredibly helpful in determining your own risk for cancer due to heritable concerns. Also, that information might help guide your own cancer screening, regardless of whether there's a heritable risk or not. A great example is if there's a family history of breast cancer, usually we're recommending mammograms starting around age 40. But if you have a first degree relative with breast cancer, your mom had breast cancer when she was, say, 45, you should actually start your mammogram screening at age 35, 10 years prior to the earliest diagnosis. So that's where the type of cancer and the age at diagnosis is really important, not just in determining your hereditary risk, but also your cancer screening plan. Here at KP Mid-Atlantic, we have an additional option on top of updating your own primary care physician regarding your family history and having them help determine next steps in genetic counseling. We also have the option where our KP members can access online healthcare for multiple conditions. I think a lot of us became familiar with this during the COVID era, where we were all getting our COVID e-visits or electronic visits, but we also have an e-visit related to cancer family history. And that will walk you through steps that are very similar to a genetic counseling visit, and looking at your family history, determining based on the family history answers that you are providing, whether you might benefit from additional genetic testing or not. It walks you through the risks and benefits of genetic testing, financial considerations related to genetic testing, and then you have the option to either go ahead and get testing or contact someone in the genetics department for a more formal consultation. But that's another way for us to get care out there so that cancer risk assessment is accessible as possible.
That's great. Thank you for sharing those resources as well. So we've talked a lot about screenings and those methods that everyone should be taking to reduce their risk and to prevent cancer detected early. But when it comes to lifestyle risk factors as well, for you, a question for you, Dr. Akoto, what are some steps individuals can take to lower the risk of developing cancer that might be more lifestyle related?
Absolutely. So these will sound familiar because you probably hear this from your physician and healthcare team all the time. But number one, really avoid tobacco. There's no health benefit at all. And we know that that can reduce your risk of about 12 of the major cancers. So that's the number one thing. Just don't smoke. And if you are a smoker, please work with your healthcare team on ways to quit. You want to have a healthy diet. So we encourage you to eat a diet rich in fruits and vegetables, whole grains, lean proteins if you can, and try to reduce red and processed meats, which may increase your risk as well. Regular exercise, and for adults, we recommend you try to get at least 150 minutes of moderate exercise spread throughout the week, as much as, spread out whichever way works for your schedule, and 2 days of resistance exercise as well. Limit alcohol. So that is, current recommendations are 2 drinks or less per day for men and 1 drink or less for women. But if you can avoid alcohol, that may actually be the best option for you if you can. We don't encourage regular alcohol usage. Sun protection. So when you're out and about, especially, considering the weather nowadays, use sunscreen, wear protective clothing, stay in the shade, avoid excessive sun exposure. And if you notice something unusual on your skin, of course, please report that to your physician to reduce your risk of skin cancer. Vaccinations. So there are actual vaccines that can prevent cancer, or at least lower your risk. And that includes things such as HPV and hepatitis B, which we know are associated with cervical and liver cancer. avoiding risky behaviors. So practicing safe sex, avoiding sharing needles, things like that that might cause bloodborne illness and lead to increased risk. Regular screenings, as we've all discussed here. So go see your healthcare provider. You've got your age-appropriate screenings, but you may also have your personalized screenings based on your own family history. Reducing exposures to carcinogens, as we already discussed, but also think about your home and your work environment as well. And then healthy sleep. We want you to aim for an average adult, about 7 hours of sleep for most of us is adequate.
Great. And I want to go back to a point you made about skin cancer and sun protection. I think there's often goes for any of our panelists, feel free to chime in, often a misconception for darker skin tones not needing sunscreen or taking different measures to protect themselves from the sun, when in fact, it is so important that regardless of skin tone, you're wearing sunscreen and protecting yourself. Anything else to share about skin cancer? I know year-round it's important, but particularly in these summer months, it is probably more of a hot topic issue that we're talking about frequently.
Yeah, we can all burn is what I like to say. And also remember, when you're wearing sunscreen, it does wear off, right? Like you sweat it off. If you're going swimming, it's going to come off. So you want to try to reapply. I believe it's like every 90 minutes or so. And then that peak time of sun exposure is about 10 a.m. to 4 p.m. So if you can avoid those times throughout the day, being outdoors, that's great. If not, really just use those best practices. Wear shaded, wear hats, wear, clothing that's going to cover your skin if you can, get to shaded areas and use your sunscreen.
Great. All very important tips. Thanks for sharing. So kind of going back to screenings for a moment, Dr. Palmer, question for you. What steps can individuals take to ensure that they receive regular screenings?
Yes, of course. So ensuring regular cancer screenings first involves, as we've said many times, understanding your personal risks, your family history, and then being proactive in scheduling appointments, putting it on the calendar, and maintaining open communication with your healthcare provider. The guidelines vary, and it is important to familiarize yourself with the recommended screening guidelines based on your age, gender, family history, and your individual risk factors. So for example, the U.S. Preventive Services Task Force recommends screening mammograms every 2 years starting at age 40. For colorectal cancer, there are several screening options, including stool-based tests, sigmoidoscopies, colonoscopies every 10 years starting at age 45. For lung cancer, an annual low-dose CT is recommended starting at age 50 if there's a significant smoking history, especially if they're currently smoking or have quit within 15 years. And for cervical cancer, there are pap smears and HPV testing depending on age and prior history. So a vital step is really familiarizing yourself with these guidelines and trying to stay on top of it, being proactive, scheduling your appointments, and ensuring that you have close follow-up with your primary care doctor. I'd like to just also say that early detection is truly vital to our mission here at Kaiser Permanente, where we're doing this effectively and in a way that is very literally saving lives. Our integrated model of care leverages technology to send automatic screening reminders to patients when they're due for mammograms, pap smears, and colon cancer screening. We actually send stool kits to patients' homes with already addressed return envelopes to make it easy. Also, our entire team will work together to ensure that patients follow through on their screening tests. For example, if a patient is overdue for mammogram and they happen to have a vision exam, that eye doctor will ensure that the patient gets their mammogram scheduled for convenient time. And the results are evident and measurable. Our approach has led to higher survival rates for Black patients than national averages. For example, KP members who identify as Black enjoy a life expectancy that is 10 years longer than non-members. And this is a result of our focus on preventive care and regular screenings. or Black patients with breast cancer have higher survival of 91%, significantly higher than the national average of 81%. And these statistics are truly a testament to the importance of screening for early detection. And so we encourage you to have those conversations within your families, with your healthcare providers, so that you can get the necessary testing, which clearly results in improved outcomes.
It's so great to hear all those success stories about how you're seeing this work well with patients, specifically with colorectal cancer. I know we've seen a rise in young onset colorectal cancer or colorectal cancer in individuals under the age of 50, specifically Black men, young Black men. So I'm so happy to hear that you are finding some success in this, and hopefully we'll continue to when it comes to those regular screenings. So before we wrap up, I'd love to let everyone just kind of share their final thoughts. And Dr. Palmer, we welcome you to start. Just any closing thoughts you have on our discussion today.
Sure. You know, I really just encourage all of us to leverage this health observance of Black family cancer awareness to join forces in the fight against cancer by really engaging in open and honest conversations within our families and with our loved ones, and also with our healthcare providers. Today, we hope that we have helped to increase awareness about the importance of early detection, and we should really all ensure that we get our screening tests when recommended, and we should all advocate for our health by proactively embracing healthy lifestyle choices, because truly together we can make a difference.
Thank you. Dr. Akoto or Dr. Pim, welcome you if you have any other final thoughts to share.
So I have what I call the rule of twos that I would like to share. And that's kind of a simple guideline to think about whether you might have an increased genetic risk for cancer or not. And I definitely should give credit to my Kaiser Permanente Southern California genetic counseling colleague, Monica Alvarado, who thought of this, but it's the rule of twos, right? So twos and then in the number two, so 2 or more cancers in the same person, that might indicate that you're more likely to have a genetic or heritable predisposition to cancer. 2 or more cancers on the same side of the family. So for example, maybe your mother had ovarian cancer and your sister had breast cancer. 2 or more risk factors. So for example, people with Ashkenazi Jewish heritage have a higher risk for breast cancer. So if you see that combination in the family, again, maybe higher risk. Or 2 or more generations with cancer on the same side of the family. So your parents' generation with colon cancer, their parents or your grandparents with colon cancer, on and on. That is another factor. And then there's the twos or TOO. So too young. So a cancer that is diagnosed at what we typically think of too young an age. In general, anyone with a breast cancer diagnosis under age 45, regardless of their family history, we look at that as concerning for a heritable risk. Under 50 years for colorectal cancer. And so if you have that kind of family history, again, you should start thinking about, is there a heritable risk in my family? Too many? So too many cancers, just cancer everywhere. Of course, that could be due to shared environmental factors, but you have to think about heritable risk. Or too many as in, for example, too many polyps. So if we see someone with a history of greater than 10 polyps over their lifetime, that's kind of a red flag for us in genetics to think of genetic predisposition to polyps and cancer, or too unusual. So a good example is men who develop breast cancer. We think of heritable risks, for example, the BRCA1 and BRCA2 genes.
Thank you. Great rule.
And very well said by my colleagues. Thank you so much for joining me today to help increase cancer awareness, especially amongst the Black community. This is a personal issue for me too. I do have a family history of cancer. And, you know, I've lost several members of my family and I miss them dearly. So I will do any and everything I can to really just help promote this and get people out there, stay engaged with your healthcare team. And, you know, we've got so many new tools that are available for us to screen and help treat. So let's go ahead and use those. So stay engaged in your health.
Great, thank you so much. And I want to thank Drs. Akoto, Dr. Pym, and Dr. Palmer so much for their expertise today. And thank you all for joining, who tuned in for this really engaging discussion. We hope everyone learned something. If you'd like to learn more about this topic or explore other health topics, we encourage you to visit kp.org/doctor. And for more information on cancer prevention and early detection, you can visit preventcancer.org. So thank you again for joining, and we hope you all have a great day.